Hello everybody, welcome to our project Stop the Shock, How Chemotherapy Infusions Can Turn into Septic Shock. This project will be presented by the Herman THC Neuro ICU group, including Jessica Estrada, Brianna Harris, Abby Jensen, Angel Minaj, Janki Patel, Brianna Pham, Jocelyn Ramirez, Lynette Rodriguez, and myself, Catherine Russell.
Hi, my name is Janki Patel. My slide is about how chemotherapy treatments can turn into septic shock. There are several steps. First one is chemotherapy affects the healthy cells that produce the white blood cells, leading to deficiency. Number 2, chemotherapy can damage the lining of the stomach, giving bacteria present in the gut direct access to the bloodstream, which in turn leads to bacteremia. 3, inflammatory cytokines are released, causing increased vascular permeability and hyperperfusion to organs. So a prolonged hyperperfusion in conjunction with systemic response leads to septic shock.
Hi, my name is Jocelyn Ramirez, and I created the flow chart for the disease progression. So once you have the initial infection where the pathogen enters the body and the body begins the inflammatory process to maintain homeostasis, if that doesn't work and the pathogen somehow enters the bloodstream, that inflammatory response becomes systemic, and so oxygen delivery is impaired and the cardiac output is decreased. If this has progressed, it goes into sepsis, and you'll have a compensatory stage where there's a continued tissue perfusion reduction, and the body will set off some compensatory mechanisms like increased heart rate, vasoconstriction, and renal absorption of sodium and water. If that keeps going, you'll have profound hypoperfusion with sustained vasoconstriction, anaerobic metabolism with lactic acidosis, and cellular edema. The body can go into SIRS, or systemic inflammatory response syndrome, where all these mediators are released, increasing vascular permeability, where the body will continue to be hypovolemic, and there can be some widespread clotting as well. If we go into the refractory stage of shock, there's prolonged inadequate tissue perfusion, endothelial damage in the capillaries, ARDS, acute kidney injury, brain ischemia, and loss of autoregulation. If that progresses, it'll go into septic shock, which is a life-threatening complication of sepsis coupled with end organ dysfunction.
Hi, this is Han Nguyen, and I will talk about the signs and symptoms of septic shock. Septic shock is a severe progression of infection that leads to dangerous low blood pressure and organ failure. Here is some signs and symptoms that can be recognized through a head-to-toe assessment. Signs of poor perfusion such as tachycardia, hypotension, or tachypnea are key findings as the body tries to compensate for hypoxemia. Confusion or change in mental status is also a common finding in septic shock due to a poor oxygenation to the brain. When sepsis happens, the body will try to shunt blood to vital organs such as the heart and the brain, so there will be signs of reduced bowel cell, cool clammy skin, and slow capillary refill time, and oliguria or anuria. Other signs include fever in the early stage or hypothermia in the later stage, and change in lab values such as increasing in white blood cell and lactic acids. As a nurse, we should know and be alert of this sign and symptom of sepsis to intervene quickly and help the patient.
This is Abby Jensen. I'm going to be talking about several comorbidities with this disease process. Comorbidities such as diabetes, COPD, and obesity can further exacerbate this disease process. These conditions can impair immune function, alter inflammatory responses, and hinder tissue oxygenation. For instance, in patients with diabetes, hyperglycemia can further compromise immune responses, making infections more likely and severe.
My name is Brianna Harris. Okay, for the nursing interventions, we're going to continuously monitor the vitals, monitor blood pressure to ensure it is not too low, perform routine neurochecks to assess for altered mental status, identify early to improve patient outcomes, monitor their CVP and cardiac index, administer fluids and medications, so fluids to improve their intravascular volume and tissue perfusion. Vasopressors may be necessary to supplement fluid administration in cases in severe hypotension. We're also going to collect labs and cultures. Blood cultures should be collected before antibiotic administration. Identify the cause of sepsis and collect blood and urine cultures and monitor urine output.
Hello everyone, my name is Jessica Estrada and I will be talking about some education points that oncology patients can use to avoid an infection leading to septic shock. So hand hygiene has been standard across the board, which is very important, so you want to educate your patients on soap and water, wash at least for 20 seconds with warm water. Hand sanitizer, use one that's at least 60% alcohol. Use soap and water when hands are visibly soiled and before eating. Maintaining line hygiene is also a great education piece because we know that many of our cancer patients have central lines for chemotherapy. So some key points we can address are keeping the line and port clean, ensuring that hands are clean before touching the ports, ensure dressings are clean, dry, and intact at all times. Since these patients are immunocompromised, we want to educate families and friends to be wary in crowds. You also want to let them know that they are exposed to more viruses that they cannot fight off, so it's very important for them to stay away from large crowds.
Hi, my name is Brianna Pham, and I'll be discussing potential complication for septic shock. A major one includes organ dysfunction, which may manifest as acute respiratory distress syndrome, acute kidney injury, or liver failure, and they need close observation of vital signs and hemodynamic stability. Another one is coagulation disorders such as DIC, and they require monitoring of coagulation profiles, and they need to monitor any signs of bleeding or thrombosis. Cardiovascular complications include hypotension or altered cardiac output. Patient may experience metabolic disturbances such as electrolyte imbalances or metabolic acidosis requiring regular laboratory tests. Crucial for timely intervention due to immunocompromised state from chemotherapy. Increased susceptibility to infections is another concern, warranting monitoring for new signs of infection or worsening clinical status.
Hello, my name is Angel Manoj.
Next, we will be discussing the risk and benefits of the treatment for chemotherapy infusion to sepsis. One of the main risks is drug toxicity. Some antibiotics used for sepsis include vancomycin and tocin, which may interact with chemotherapy drugs, increasing the toxicity. Vancomycin can cause nephrotoxicity, ototoxicity, and Redman syndrome. Some chemotherapy drugs like cisplatin causes kidney injury, so using antibiotics on top will lead to more toxicity and damage. Another risk is antibiotic resistance. Prolonged use of broad-spectrum antibiotics can lead to resistance, making future infections harder to treat, especially for patients with weakened immune system. Patients will also have a delayed chemotherapy because treating sepsis may require stopping the chemotherapy treatment temporarily, which could impact cancer treatment effectiveness. Another risk is increased mortality risk. Chemotherapy can continue to weaken the immune system, making the patient more vulnerable to additional infection, and thus chemotherapy patients carry a higher risk of death, particularly if not treated properly. And now moving on to the benefits. One of the main benefit is prompt infection control. Aggressive treatment can reduce the risk of severe complications. Another benefit is improved survival. Early intervention can significantly improve the survival rate. Another one is organ function preservation. Effective treatment helps prevent septic shock and multi-organ failure. And last one is supportive care. This includes giving fluids to the patient, vasopressors, and sometimes mechanical ventilation to maintain that vital organ function.
This is Lynette Rodriguez. Continuing the conversation, which medications used in chemotherapy increase the risk of sepsis, and its progression, and through what mechanisms do these drugs compromise immune function or contribute to sepsis-related complications? How should this knowledge influence treatment decisions and monitoring strategies for these patients? These are our references. And that's it. Thank you.